Greetings, Edward.
Greetings.
What is your favourite bone of the body?
The humerus. What is your favorite bone of the body?
The sacrum.
Say what?
Sacrum.
Sacrum. Damn near killed him.
What should the skeleton's name be?
Steve.
Hey team, so we're going to talk about diagnosis first. The sacrum is a difficult bone to diagnose, as much as I love it. It moves on transverse axes as well as oblique axes. So, as you can see in our friend Steve here, the sacrum can move in a forward tilt in this way to the right direction, a forward tilt in that way to the left direction. It can also move backward and forward. So, for our first technique here, we are going to diagnose the sacrum in a seated flexion test, and then we'll proceed to treat the sacrum in a muscle energy technique. So, as we've done before, we are going to use the landmark of the PSIS in the seated flexion test, and a positive test is the PSIS that moves superiorly first. So, I am first going to palpate the iliac crest on Edward, and then I'm going to work my thumbs down to hook underneath the PSIS. And then I'm going to ask him, go ahead and bend forward. Whoa, look at the discrepancy there. He has a positive right PSIS shift superiorly. Therefore, he has a the left oblique axis. Now that I've performed the seated flexion test, and I know which axis I'm looking at, I'm going to palpate Edward's sacral sulci and inferior lateral angles to determine if his axis is forward rotating or backward rotating. So, my first landmark is my PSIS on bilateral sides of his sacrum. And then apply gentle pressure just inferior to that region. Edward, do I have permission to palpate your inferior lateral angle?
Yes.
I work my way down to palpate his inferior lateral angle. I feel more deep on the right side. And I feel more shallow on the right sacral sulci.
Where in relation to the PSIS are the sacral sulci, Nina?
Just inferior and medial. The ILA are inferior to the sacral sulci on the same line. Again, please reference your Nicholas book for diagnoses of the sacrum. This is one of many that a sacrum could prefer. Edwards' sacrum is diagnosed as a right torsion on a left axis. There is also left torsion on a right axis. There is right torsion on a right axis. There is left torsion on a left axis. And there's also unilateral torsion on the left axis, unilateral torsion on the right axis.
Flexion and extension.
Also, bilateral flexion and bilateral extension. So, we're going to go ahead and treat Edwards torsion with muscle energy. So, a quick cheat is to have the patient lay on the side of their axis. So, because Edwards' axis is left, I'm going to have him lay lateral recumbent on his left side. Also, because he is a right on left torsion, which is a backwards torsion, I am going to have him lay backwards during this technique. So, right on left and left on right are backward torsions. Right on right and left on left are forward torsions. In that case, I would have him lean forward. All right, so go ahead and scoot towards me. Scoot, scoot, scoot. Not going to let you fall. Or will I? Go ahead and lean backwards. Cross your hands like this, like you're mad at me. And I'm going to have him pull up his leg like this. Straighten your bottom leg, please. And have it fall off the side of the table here. So, as we do with all muscle energies, we're going to run through this 3 to 5 seconds of effort against the physician's force. Relax. And bonus points, incorporate breathing. All right, so pull up towards me. 1, 2, 3. Relax. Big deep breath in and out. Pull up towards me. 1, 2, 3, and relax. Big deep breath in and out. Pull up towards me. 1, 2, 3, and relax. Big deep breath in and out. Great. I'm going to reset you. And after this, you would perform another seated flexion test, and you would have him lay on his belly and test his sacrum to check whether or not your treatment made a difference. Hey friends, do you want a great shotgun technique to make every patient feel like you're making a huge difference in their lives? To give them that pop sensation in their spine that they're craving from an OMT treatment? Me too. Let's do it. So, a common source of dysfunction is the sacroiliac joint between S1 and L5. So, a very simple technique that you can do in the office is called the lumbar roll, also known as the OB roll. So, we're going to do it on Eddie.
Because I'm pregnant.
Because he's pregnant. So, take your hand like this, palm up, and opposite elbow. Instruct the patient to clasp their hands together and put them firmly behind their neck like this. So, I'm going to take his opposite elbow here, lay my hand palm up on his chest, stabilize here on his ASIS, and patient, I'm going to roll you forward. Oh yeah, there we go. So, I like to do both sides. Do you feel immediate relief in your sacroiliac junction?
Yes.
Great. Hey team, our final treatment today is going to be directed at dysmenorrhea. So, as we know, the parasympathetic innervation is S2 through S4 for the genitourinary system. And so we can help out a lot of women with dysmenorrheic pain during their menstrual cycle. Edward, are you having menstrual pain right now?
Tons of it.
Great. Well, this technique is for you. So, what we're going to do is, after asking the patient for permission, can I have permission to palpate your sacrum?
Yes.
Great. Let's proceed. And I'm going to place my hand like so on the top of his sacrum, S1. The bottom of my hand will be more toward S4, S5. And then I'm going to put my other hand directly on top in an opposite direction. And we're going to induce some sacral rocking into this area to reset those parasympathetic nerves. Just like this. Big deep breath in. And out. 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 Great. How do you feel now, Eddie?
So much less menstrual pain.
Great. Our work's done for the day. Goodbye.